Do you know the song for Mr. Rogers' Neighborhood? It's a beautiful day in the neighborhood, a beautiful day for a neighbor. All right, I won't sing the whole song, but did you ever think about what he was singing? Well, I think Mr. Rogers had 3 things he wanted to share. 1, live in the land of make-believe. When we dream, and we should, what does a successful community look like? Second thing is, look for helpers. There's a lot of gifted people out there in our community who want to help, so look for them. And the third thing is, be a good neighbor. He reminds us that everybody's probably going through something they're not telling you about. So be a good neighbor to someone who needs one. Well, when U.S. News and World Report publishes their best places to live issue, what are they looking at? How are they measuring community success? Well, they're looking at things like job market, average salary, and migration. Well, here's the thing. I contend that we're looking at community success all wrong. And I think Mr. Rogers was onto something. What if we measured community success based on how well we cared for each other? Or more specifically, how well we cared for our homeless? Well, when my kids were 5 and 7, I was divorced, living in Colorado, and I didn't have family living nearby. If it hadn't been for the love and support of my 4 closest friends, I could have easily lost my job, my home, and subsequently my children if I failed to provide for them. I, like many Americans, often live just 1 paycheck away from homelessness. Well, today I'm very blessed to be the director of a special medical practice called Street Medicine. For 15 years, I've been in the emergency department and caring, I thought, appropriately, but I found myself feeling ineffective when it came to addressing the social issues that affected my patients' health. But street medicine has allowed me to close that loop and look at community success differently and through a different set of lenses. So what exactly is street medicine? Well, in a nutshell, it's an alliance of professionals who provides free health care to persons experiencing homelessness, affectionately called street neighbors by our team. And this core team of 4, we have 2 physician assistants, a nurse clinical coordinator, and a community outreach worker. We work closely with a team of caregivers, and we provide 4 services. 1, we have clinics and soup kitchens and shelters. We have consultations with our homeless patients who are hospitalized to let them know how we can help them before they're discharged. We also have medical respite care, a partnership with a local shelter where we can offer our male patients a place to recuperate if they're too ill to hit the streets, but then not ill enough to stay in the hospital. And then our 4th service is my favorite, street rounds. And that's when we go into the community, we go under bridges, alleyways, into the woods, and we provide health care for our patients who are too ill to come to our clinics. So tonight, I'd like to take you on street rounds with me. Now, while logistically it may be difficult to get 250 of you traipsing through the woods with me, I think you can appreciate the journey from the safety of your chair. So let's go meet 3 of your neighbors. So the first neighbor I'd like you to meet is Pablo. He's an 82-year-old Mexican national, and he has served in the Army, Mexican Army for years, and he's had a tough 2 years. He lost his job when he had his leg amputated secondary to complications of diabetes. He's had lost his home, and then lost the support of his family, who found it too difficult to take care of him. He's been living for the past year under a tarp in an alleyway across from a church parking lot for about a year now. And luckily, he's got some community support. He has a little bodega around the corner that gives him some hot meals every once in a while. And he has 2 community members who have not only bought his insulin for him, but they've stored it because it needs to be refrigerated. And they've also daily come and tested his blood sugar and given him his insulin. Well, tonight they've asked us to stop by and see how Pablo's doing, because he's developing a sore on the amputated stump. And so here we are. See Pablo. Hola, Pablo. Medicina de calle, ¿cómo estás? So after examining Pablo, we cleanse and dress his wound. We decide to put him on some antibiotics, and as a special surprise, he loves his frijoles, so we'll leave that with him as well. And we'll have his friends bring him to our soup kitchen clinic so that we can check up on him and see how he's doing with his antibiotics. So the next neighbor I'd like you to meet is Rene. Rene is 40, and I met her about 5 years ago when I started work at a local coalition against sex trafficking. At the time, I was teaching graduate physician assistant students, and I was teaching them about the relationship between homelessness and sex trafficking in preparation for a free clinic that we were holding in a residential home for sex trafficking victims. So Renee's story is a tough one. As a child, she was sold for sex by a loved one who was using her to pay for a drug habit. As a result, she became a ward of the state, eventually actually got her GED, and went off to college. When she was in college, she got pregnant and dropped out immediately. You see, it was actually an easy decision for her. She was told that for many years she'd never be able to have children because of all the sexual trauma she endured as a child. So after having her baby, her boyfriend was incarcerated and she found herself homeless. After probably 2-3 nights, she said, of sleeping in the hallway of an apartment, she decided to accept the help of a man who offered shelter and food. That act of kindness ended up being a 15-year nightmare of forced prostitution. Now, when I met Rene, she was just exiting the life of prostitution, and she was still homeless and really struggling. She has a criminal record and had no transportation, and so she was really struggling. And so tonight, we're actually going to meet her at the Dunkin' Donuts because she has got a job interview and she's looking to have a sore looked at on the bottom of her lip that she gets when she's super stressed. Now, I actually don't have the medicine in my backpack that I need to, so I'm going to have to call it into the pharmacy. But I do have feminine hygiene products, which are always appreciated and actually a little costly, so I'll leave those with her. And then we'll check in 2 days and see how her interview went. So you've met Rene. Now I'd like you to meet Louise. She's 52, hard of hearing, and she's got such horribly debilitative arthritis that she needs a walker to get around. Well, I met Louise just last week, actually. Hospital security called and said that there was a woman in the lobby who was asking for help at the front desk and said she was homeless. So I went to meet her, and Louise shared with me that she was living with her daughter, and her daughter took her disability check and then kicked her out on the streets. She was able to stay in a local shelter, but then that shelter closed prematurely due to lack of funding. So she finds herself homeless. Well, in the past week, Louise has lived in a 24-hour retail store. She's lived in the lobby of our hospital and on the park bench around the corner. So our team decided, while she's waiting for her housing, let's get her set up. We have her in a tent, sleeping bag, water, toilet paper, and today we're checking on seeing how our first night out in the tent was. So she shares that the ground was a little hard and her knees are a little sore, so we have some Tylenol for her. So Tylenol, some more water, and she's an avid reader, so I brought her a book. So now that you've met 3 of your neighbors, I'm sure some of you are wondering, so how many people do we have in our community who are actually homeless? Well, there's a method that is via an information system, and they count persons who register for housing and services. Well, they reported 1,380 persons to be experiencing homelessness between January and September 2017. Unfortunately, that number is actually probably not counting some very important populations. One, they're not counting persons like Pablo, who are undocumented immigrants and likely not registering for services because of fear of deportation. 2, they're not counting persons like Rene, who are having survival sex for shelter because she's not registering for services. And 3, it's not counting persons like Louise, who are staying with family and friends or couch surfing, and that's not counted as one of the chronic homeless. So the number of persons experiencing homelessness is actually far worse than we ever imagined. There's a study done in 2015. It surveyed 3 area emergency departments and found that 7% of the persons were experiencing homelessness. That number equates to 9,200 persons, and that's just in 3 emergency departments, just in 1 hospital network, and only English-speaking patients. Is this the kind of community that we want to live in? Well, did anyone see the movie 2009 Avatar, sci-fi creatures, thin blue? Well, there's a really terrific line in that. That's when Zoe Saldana has just saved Sam Worthington's life, and he's being held in her arms, and she looks up at her and he says, "I see you." Well, I'm a bit of a geek when it comes to word phrase origins, and I looked up what that meant, the significance of that. And I found that there's a South African tribe, and their greeting is Sawubona, which means, "I see you." And the response to that is Sakona, which means, "I am here." So when you put that together, when you see me, you bring me into existence. Isn't that inherently what we all crave? To be seen? Well, I have to be honest with you. In order for us to do this heartbreaking work day after day in street medicine, our team has had to redefine success. Sometimes we can't help our patients manage an addiction or help them get into a shelter bed. So we have to be okay with knowing that they feel loved. So I have a challenge for you, and I'd like you to think about how you'd redefine your community success. You already have the playbook. Mr. Rogers gave it to you. 1, live in the land of make-believe. We have to be able to think of innovative ways to care for our homeless. 2, you have helpers. Whatever your sphere of influence, you have the ability to see your neighbor and bring him or her into existence. And 3, be a good neighbor. There is a delightful nun. Her name is Sister Mary Lou Kaunaki, and she did some pretty impressive work in Erie, Pennsylvania's most vulnerable neighborhoods. And she said, frankly, there isn't anyone that you couldn't learn to love once you've heard their story. And I couldn't agree more. Thank you.